Welcome, everyone. Today we're doing a deep dive into the world of epilepsy treatment, and specifically, we're going to focus on a newer medication called Brivaracetam. You might know it as the AED, that's anti-epileptic drug, with an edge. We'll explore what makes it tick, how it compares to a more established drug called Levetiracetam, and what this all means for patients living with epilepsy.
You really hit the nail on the head there. It's about so much more than just comparing two medications, right? It's about really understanding the challenges of treating a complex condition like epilepsy.
Exactly. So to set the stage, can you remind us what makes epilepsy so challenging to treat in the first place?
Well, epilepsy isn't just one thing, you see. It's a whole bunch of neurological disorders all grouped together, and they all share this common thread: recurring seizures. And these seizures, well, they aren't always the dramatic, convulsive episodes that people often picture.
Right, like it's not always someone falling and having visible spasms.
Exactly. It's a whole spectrum of experiences. Think altered consciousness, like a temporary disconnect from reality, or unusual sensory experiences, like seeing flashing lights or hearing strange sounds. And sometimes it's even more subtle, like behavioral changes that are really hard to pin down.
Wow, that's a lot more varied than I think a lot of people realize. What causes these very different types of seizures?
That's the million-dollar question. It's often a whole mix of things. Sometimes there's a genetic predisposition, it runs in families. Other times it's triggered by brain injuries, infections, even tumors. And sometimes the cause is a total mystery, which, you can imagine, makes finding the right treatment even harder.
It's like trying to solve a puzzle, but you don't have all the pieces.
Exactly. And that's where these medications we're talking about today, like Brivaracetam and Levetiracetam, come in. They're designed to target those abnormal electrical signals in the brain that cause seizures. But they do it in slightly different ways, which is what makes this so interesting.
That's what we're here to unpack. So let's start with the newer kid on the block, Brivaracetam. It was introduced globally back in 2016 by UCB, but it wasn't available in India until 2021, thanks to NATCO.
Right. And you mentioned it has an edge. Well, part of that comes from how it interacts with this specific protein in the brain. It's called SV2A.
Okay, I have to admit, SV2A, you're going to have to break that down for me. What is that, and why is it important?
Absolutely. So think of SV2A like a lock on a door. These anti-epileptic drugs are keys, and they're trying to fit into that lock. Now, Brivaracetam, it's like a key that's been specially designed to fit that lock perfectly. In more technical terms, we say it binds to SV2A with a 15 to 30 times higher affinity than Levetiracetam.
Wow, 15 to 30 times more effectively. That's incredible. I'm curious, what does that tighter binding actually do in the brain? Like, what's happening at that molecular level?
Essentially, it's all about calming down those erratic electrical signals we were talking about. Think of it this way. The tighter Brivaracetam binds to SV2A, the more effectively it can modulate those signals, like fine-tuning a radio frequency to get rid of static.
So it's not that one drug is stronger than the other, but it's more about how precisely it's working on those specific brain signals.
Exactly. It's about precision and how effectively it stops those signals that lead to seizures. Now, Levetiracetam also targets SV2A, but not with the same tightness. Right. It's been around longer, since 1999, and we have a really solid understanding of how it behaves in the body.
So would it be fair to say that, like, for someone who is prioritizing fast action and potentially fewer of those mood-related side effects, Brivaracetam might be a good option, but if they're looking for something with a longer track record and lots of data, Levetiracetam might be the way to go.
You've summed it up perfectly. You highlighted a really crucial point there. It's about finding that right fit for each individual, considering both their medical needs and what's important to them personally.
Absolutely. It's not just about what looks good on paper, it's about what actually works best for someone living with epilepsy every single day. Which I guess brings us to another important difference between these medications: how our bodies actually process them.
You're talking about pharmacokinetics, right?
Exactly.
How a drug is absorbed, distributed, metabolized, and then eventually eliminated by the body.
Exactly. And it sounds kind of complicated, but it's really important for understanding how a drug's going to work for someone, right?
Absolutely. And this is another area where Brivaracetam seems to have a bit of an advantage. It shows what we call linear pharmacokinetics.
Mm-hmm.
Sounds very technical, but what it really means is your body processes it very consistently. And that makes it easier for doctors to figure out the right dosage and predict how your body's going to respond.
So it's more predictable, which I imagine is reassuring, right, for
Work.
both the patient and the doctor.
Exactly. Levetiracetam, on the other hand, can be a bit more variable in how it's absorbed. So sometimes finding that optimal dose can be, a little bit trickier.
So with Brivaracetam, there's less guesswork, potentially faster, more reliable results.
That's the general idea, yeah. It's about minimizing those side effects as much as possible and really maximizing that seizure control.
Speaking of side effects, is something I wanted to ask you about. Both of these medications, they can cause side effects, right?
That's true, yeah. And it's important to remember that any medication can have potential side effects.
Of course. What are some of the common side effects that people might experience with these medications? And are there any key differences between, say, Brivaracetam and Levetiracetam in terms of side effects?
So with Levetiracetam, some of the more common ones that are reported are mood changes. Things like irritability, feeling down, sometimes even aggression, dizziness and fatigue are also pretty common.
Those sound like they could really impact a person's quality of life.
Absolutely. It can make it tough to work, to study, even just to enjoy everyday activities.
Right. So what about Brivaracetam? Does it have similar side effects?
It can, but here's where it gets interesting. Studies have shown that those neuropsychiatric side effects, like the mood changes and aggression, tend to be less frequent with Brivaracetam. In fact, some people even report feeling better mood-wise after making the switch from Levetiracetam.
Now that's a silver lining. Fewer seizures, A&D, potentially a better mood. That's huge.
It certainly can be, but of course everyone responds to medication a little bit differently, so there are never any guarantees.
That makes sense. So we've talked about efficacy, side effects, even how these drugs are processed in the body. But I'm curious about dosage. Are there any big differences there between how Brivaracetam and Levetiracetam are actually prescribed?
Yeah, there are. So levetiracetam, it's typically prescribed at doses ranging from 1,000 to 3,000 milligrams per day, whereas brivaracetam, the doses are usually much lower. We're talking 50 to 200 milligrams per day.
Wow, that's quite a difference. Why such a big gap in dosage? Well, remember how we were talking about brivaracetam's tight binding to that SV2A protein? Because it's so much more efficient at actually reaching its target in the brain, you need a much smaller dose to really get that desired effect.
So it's like the difference between needing a whole teaspoon of sugar versus just a pinch to sweeten your tea.
That's a great analogy. It's not that one is stronger necessarily, it's more about how efficiently they work on that molecular level.
That makes a lot of sense. Now, before we move on, I do want to, address the elephant in the room a little bit here. We've been focusing a lot on the medications themselves, but I think it's important to acknowledge the social and economic realities of living with epilepsy, right? Because it's about so much more than just taking medication.
Absolutely. Epilepsy has this ripple effect. It extends far beyond the doctor's office, and it really impacts every aspect of a person's life.
Exactly. So let's shift gears just a little bit here and delve into that often overlooked aspect of epilepsy. What are some of the challenges that people with epilepsy face outside of their medical treatment? Well, one of the biggest hurdles is the stigma that still surrounds epilepsy, unfortunately.
We're back and ready to continue our deep dive into the world of epilepsy. And this time, we're really going to shift gears and focus on something that's often overlooked: those social and economic realities of this condition.
Yeah, it's a side of epilepsy that really doesn't get talked about enough. We can talk about medications and treatments all day, but we can't forget about the day-to-day challenges, the stuff beyond medical care that people with epilepsy have to deal with.
Exactly. It's about understanding the whole picture, right? Not just the medical side of things. So you mentioned stigma before the break. Can you elaborate on that a little bit? Like, what does stigma actually look like for someone who has epilepsy?
Well, it can show up in so many ways.
Mm-hmm.
And it often comes from these misconceptions, these a lack of awareness about what epilepsy actually is. Think about it. Historically, epilepsy has been this big mystery. It's been feared. And even though we've made progress, those outdated views, they're still out there.
Yeah, it's like that old saying, knowledge is power, right? The more we understand something, the less likely we are to be afraid of it.
Exactly. And that lack of understanding, it can lead to discrimination. Sometimes it's subtle, sometimes it's blatant. Like some people with epilepsy are treated differently by their friends, their family, colleagues, even if it's not intentional. Others have to deal with discrimination in employment or when they're trying to pursue education.
It's heartbreaking to think that someone could be denied a job or a chance to chase their dreams simply because they have epilepsy.
And it happens more often than you think, unfortunately.
Yeah.
It's why it's so important to, just talk about it. Have these open, honest conversations about epilepsy so we can bust those myths and break down those barriers.
Absolutely. Now, we've talked about the social stigma, but what about the economic implications? How does having epilepsy affect, someone's financial well-being?
Well, the financial burden can be pretty heavy. A lot of times it starts with just the cost of healthcare itself. Doctor's appointments, medications, sometimes even surgery. It all adds up really quickly.
And then there's the potential impact on their employment, too.
Exactly. Some people with epilepsy, they might have trouble finding or holding down a job, especially if their seizures aren't well controlled or if they're facing, discrimination from employers.
So it's like a double whammy, the financial strain of all the medical expenses and then possibly losing income on top of that.
Exactly. And let's not forget the emotional toll it takes, on individuals and families. The stress, the uncertainty can feel really overwhelming.
It's true. We can't underestimate that aspect of it at all. It's a lot to carry, both for the person with epilepsy and the people who love and support them.
And that actually brings us to another really important aspect of epilepsy that often gets overlooked, the experience of the caregivers.
Oh, absolutely. The unsung heroes in all of this, the ones who provide so much care and support behind the scenes.
Yeah. Caregiving for someone with epilepsy, it's incredibly rewarding, but it is also incredibly demanding. Imagine living with this constant worry that your loved one could have a seizure at any moment, right? At home, at school, out in public.
Yeah. It must be exhausting, physically and emotionally.
It really is.
Yeah.
Caregivers often find themselves, taking on all these responsibilities.
Yeah.
Managing medications, making appointments, providing emotional support, advocating for their needs.
Yeah, it's like a 247 job, and so often it's unpaid and honestly underappreciated.
That's exactly right. And it's not even just the practical tasks, right? It's the emotional labor involved, too. They often put their own needs totally on hold to care for their loved one, which can lead to burnout, resentment, even their own health problems.
It's like they're carrying the weight of the world on their shoulders, and a lot of times they don't ask for help or even realize they need it.
Exactly. And that's why it's so important to really recognize and appreciate caregivers, the vital role they play in the epilepsy community, and to provide them with the support that they need.
Absolutely. Support groups, counseling, even just someone to listen to them. Those things can make a world of difference.
They really can. It's about letting caregivers know, hey, you're not alone. Your feelings are valid. And it's okay to ask for help.
So well said. So as we start to wrap up this deep dive into the world of epilepsy, what are some key takeaways you hope our listeners will remember from our conversation today?
For me, it really comes down to this. Epilepsy is a complex condition, but it absolutely does not have to define a person's life. With the right treatment, the right support, and just a little understanding from the people around them, individuals with epilepsy, they can thrive.
That's such a powerful message, and one that I really hope resonates with everyone listening.
It's about, creating a world where people with epilepsy feel seen, they feel heard, they feel supported, not just by their families and friends, but by society as a whole.
Absolutely. It's about a world where everyone has the opportunity to live a full life, a meaningful life, regardless of their health challenges.
And you know what? Sometimes that just starts by having these kinds of conversations, open and honest conversations, like the one we've had today.
You're so right. And on that note, I think that brings us to the end of our deep dive into the world of epilepsy. We've covered so much. Thank you so much for joining us on this journey. It's been enlightening, to say the least.
It really has.
Until next time, take care, everyone, and stay curious.